Your body is constantly communicating with you, and sometimes it sends urgent signals that something is seriously wrong. Recognizing these warning signs can mean the difference between a swift recovery and a life-altering tragedy. Today, we're diving into 7 physical symptoms that medical experts agree should never be ignored under any circumstances. These are not vague aches or minor inconveniences. They are red flags that demand immediate hospital care. No waiting, no hesitation. This isn't about scaring you. It's about empowering you with the knowledge to protect your health and potentially save your life or the life of someone you love. As we age, it's tempting to dismiss unusual symptoms as just part of getting older or to avoid seeking help because we don't want to bother anyone. But for older adults, delaying action can turn a manageable issue into a major crisis. By understanding these critical symptoms, you take control of your health and give yourself the best chance for a positive outcome. In this comprehensive guide, we'll explore each of these 7 warning signs in detail, explaining why they're so serious, what they might indicate, and why time is of the essence. We'll also share real-life stories to illustrate the importance of acting quickly and provide practical tips to help you respond effectively. Stay with us until the end, because one of these signs might just save your life. Let's get started. 1. Slurred speech or facial drooping. One of the most alarming and time-sensitive symptoms you can experience is slurred speech or facial drooping. These are hallmark signs of a stroke, a medical emergency that requires immediate action. If you suddenly find it hard to speak, your words come out garbled, or one side of your face feels numb or looks uneven, don't wait to see if it passes. Head to the hospital immediately. Other stroke symptoms include difficulty lifting one arm or a tendency for it to drift downward when raised. These aren't signs to sleep off or attribute to fatigue. They indicate that your brain may be in serious trouble. A stroke occurs when the blood flow to part of the brain is interrupted, either by a clot ischemic stroke or a burst blood vessel hemorrhagic stroke. Every minute a stroke goes untreated. Approximately 9 million brain cells die. According to neurologists, this can lead to permanent damage affecting your ability to speak, move, or even live independently. For older adults, strokes can strike without warning, often during routine activities like reading, eating, or watching TV. The subtlety of these symptoms makes them particularly dangerous, as they may not feel scary enough to prompt immediate action. Consider the story of Robert, a 68-year-old Vietnam veteran. One morning, while sipping coffee, he dropped his cup with his right hand and couldn't understand why. When he tried to call out to his wife, his words sounded jumbled. She noticed his smile was crooked and immediately called 911. At the hospital, doctors confirmed Robert was having a stroke and administered treatment within an hour. Thanks to his wife's quick thinking, Robert made a remarkable recovery. If she hadn't acted so fast, I might be in a wheelchair or worse. He later said, his story underscores the importance of recognizing stroke symptoms early. The medical community uses the acronym FAST to help identify strokes. Face is one side of the face drooping or uneven. Arms. Can you raise both arms equally? Or does one drift downward? Speech. Is speech slurred or difficult to understand? Time. If any of these signs are present, call emergency services immediately. Time is critical. For seniors, stroke symptoms can be mistaken for other issues, like dehydration or tiredness. But waiting to see if they improve can lead to irreversible damage. If you or someone you know experiences slurred speech, facial drooping, or sudden weakness, don't hesitate. Call 911. Note the time the symptoms started and get to a hospital. Acting fast can preserve your ability to walk, talk, and live independently. 2. Sudden chest tightness or pain. Sudden chest tightness or pain is one of the most urgent warning signs your body can send. It might feel like a squeezing sensation, pressure, or a burning pain that radiates to your arms, shoulders, neck, or jaw. While it's tempting to dismiss it as heartburn, indigestion, or stress, this could be your heart signaling a life-threatening problem, such as a heart attack. For older adults, the signs of a heart attack can be subtle, making them even more dangerous. Unlike the dramatic chest-clutching scenes in movies, heart attacks in seniors may present as a dull ache, a fluttering sensation, or a vague sense of unease. Cardiologists emphasize that time is critical during a heart attack. I've seen too many patients arrive too late because they thought it was just indigestion. One cardiologist shared, If there's even a slight chance it's cardiac, get checked immediately. Additional symptoms to watch for include dizziness, shortness of breath, nausea, or sudden exhaustion. Even without physical exertion, these signs are particularly concerning in seniors, as the heart's ability to compensate for stress diminishes with age. Take Helen, a 74-year-old retired school teacher. One afternoon, while reading a book, she felt an unusual tightness in her chest. It wasn't excruciating, but it persisted for over 20 minutes. Thinking it might be gas, she hesitated to act. Fortunately, her daughter insisted they go to the hospital, where tests revealed Helen had suffered a mild heart attack. Prompt treatment allowed her to recover fully. "If I'd waited, I might not be here," Helen said. "Now I listen to my body the first time." If you experience unfamiliar or persistent chest discomfort, especially with symptoms like sweating, nausea, or shortness of breath, don't second-guess yourself. Call emergency services or have someone drive you to the hospital. Even if it turns out to be something less serious, the peace of mind is worth it. Waiting could mean the difference between recovery and permanent heart damage. If you're finding this information valuable, please comment number 2 below to let us know you're here, and consider subscribing to stay informed about critical health topics. 3. Shortness of breath without exertion. There's a big difference between feeling winded after climbing stairs and struggling to breathe while sitting still. Sudden shortness of breath without physical exertion is a serious red flag that could indicate conditions like heart failure, pneumonia, or a pulmonary embolism, a blood clot in the lungs. These are medical emergencies that require immediate attention, especially in older adults, whose lung and heart function may already be compromised by age. A respiratory specialist once said, "If breathing becomes difficult for no clear reason, that's your body sounding an alarm." It's not just aging, it's a cry for help. For seniors, shortness of breath can appear suddenly, even during restful activities like watching TV or lying in bed. You might feel like you can't get enough air, or your breathing might become rapid and shallow. These symptoms are particularly concerning if they're accompanied by chest pain, dizziness, or a sense of panic. Walter, a 76-year-old retired electrician, experienced this firsthand. One evening, while watching his favorite show, he suddenly felt like he couldn't catch his breath. There was no chest pain or fever, just an overwhelming sense of breathlessness. His daughter, alarmed by his distress, rushed him to the hospital, where doctors discovered a small blood clot in his lung. "If I'd waited until morning," Walter said, "I might not have woken up." Thanks to timely intervention, he recovered fully. Shortness of breath without exertion isn't something to monitor or wait out. It could indicate a problem with your heart, lungs, or blood vessels, and delaying treatment can lead to worsening symptoms or permanent damage. If you experience sudden difficulty breathing, call 911 or get to the emergency room immediately. Note any additional symptoms, such as swelling in the legs or a rapid heartbeat, as these can help doctors diagnose the issue quickly. Acting promptly can make all the difference. Or unusual confusion or sudden disorientation. Sudden confusion or disorientation in older adults is often mistaken for a normal part of aging. But when it comes on abruptly, it's a serious warning sign. If you or a loved one suddenly forgets familiar things, seems disoriented about time or place, or speaks in ways that don't make sense, it could indicate a stroke, brain infection, low oxygen levels, or a severe reaction to medication. These conditions are medical emergencies that require immediate attention. A hospitalist once noted, "In older adults, the brain is often the first organ to signal trouble. Sudden confusion is like an emergency light flashing. Unlike gradual memory changes associated with aging or dementia, sudden confusion is an abrupt shift that's out of character." For example, a senior who's normally sharp might struggle to recall their address, get lost in their own home, or repeat the same question despite receiving an answer. Linda, an 80-year-old who lived independently, experienced this when her neighbor found her standing in their apartment building's hallway, unsure of how she got there. She was fully dressed but seemed startled and kept asking the same question. Her family initially thought it was dehydration or fatigue, but at the hospital, doctors diagnosed a urinary tract infection (UTI) that had triggered delirium, a condition that can cause confusion in seniors. With antibiotics and fluids, Linda returned to her normal self within days. "I didn't know confusion could come from something like that," her daughter said. "Now I'll never ignore it." Sudden confusion can also stem from low blood sugar, medication side effects, or even a silent stroke. because the causes are varied and serious. It's critical to seek medical care immediately. Don't assume it's just a bad day or wait for it to pass. Call emergency services or take the person to the hospital and provide doctors with details about when the symptoms started and any recent changes in medication or health. If you're finding this section helpful, please comment. Number 4, below to let us know you're still with us. Severe or sudden abdominal pain. Aches and pains are common as we age, but severe or sudden abdominal pain is not something to brush off. If the pain is sharp, persistent, or worsens rapidly, it could indicate a life-threatening condition like appendicitis, a perforated ulcer, pancreatitis, or internal bleeding. In older adults, abdominal pain can also signal a blocked intestine or a ruptured organ, both of which require urgent intervention. Unlike younger individuals, seniors may not always show classic symptoms like fever or swelling, making it even more critical to act quickly. A trauma surgeon once explained, "When a senior complains of sudden abdominal pain, we take it very seriously because time makes the difference between a fixable problem and a fatal one." For example, a blocked intestine can cut off blood flow, leading to tissue death, while a perforated ulcer can cause internal bleeding that escalates rapidly. The pain might feel like a stabbing sensation, a deep ache, or a diffuse discomfort that doesn't go away, and it may be accompanied by nausea, vomiting, or dizziness. Frank, a 72-year-old widower, learned this the hard way. One evening after dinner, he felt a sharp pain in his lower abdomen. Assuming it was gas, he took antacids and went to bed. By morning, the pain had spread, and he was too weak to stand. His daughter called an ambulance, and doctors discovered a twisted section of his intestine that required emergency surgery. "I thought it would pass," Frank said. "I didn't realize how fast things can go downhill." His quick action saved his life. If you experience intense abdominal pain that's unfamiliar or doesn't subside within 20-30 minutes, don't wait to see if it improves. Call 911 or get to the emergency room, especially if the pain is accompanied by fever, vomiting, or difficulty moving. Keep track of when the pain started and any other symptoms to help doctors diagnose the issue. Being cautious could save your life. 6. Persistent vomiting or vomiting blood. Occasional vomiting from a stomach bug or spoiled food is unpleasant, but usually harmless. However, persistent vomiting that lasts for hours or vomiting blood, no matter how small the amount, is a medical emergency. Persistent vomiting can lead to severe dehydration, electrolyte imbalances, and kidney issues, particularly in seniors who are more vulnerable to these complications. Vomiting blood, whether bright red or dark and grainy, like coffee grounds, may indicate internal bleeding, a torn esophagus, or a ruptured ulcer. A gastrointestinal specialist once said, "Blood and vomit is never normal. It's one of the fastest ways we identify internal bleeding in older adults." This can result from medications like nonsteroidal anti-inflammatory drugs, NSAIDs, which are commonly used for arthritis, or from undiagnosed conditions like gastritis or liver disease. Seniors may not always recognize the blood, mistaking it for food or bile, which makes it even more critical to seek help. Evelyn, a 79-year-old woman, experienced this after taking over-the-counter pain relievers for her arthritis. One night, she started vomiting after dinner and noticed dark flecks in the sink. Thinking it was just food, she hesitated to act. Her grandson insisted on calling for help, and at the hospital, doctors found a bleeding ulcer that had been developing for months. "I had no idea it was that serious," Evelyn said. "If I hadn't gone in, I might not have lasted another day." If you or someone you know experiences persistent vomiting or sees blood in their vomit, don't wait. Call emergency services or go to the hospital immediately. Note the color and consistency of the vomit and any recent medications or symptoms to provide doctors with critical information. Quick action can prevent life-threatening complications. If you're finding this guide helpful, please comment. Number 6, below to let us know you're still following along. Your support helps us continue sharing valuable health insights. 7, high fever with stiff neck and sensitivity to light. A fever is often a sign that your body is fighting an infection. But when it's high above 100, 40 GF or 38 degrees, and accompanied by a stiff neck, headache, or sensitivity to light, it could indicate meningitis, a life-threatening inflammation of the membranes surrounding the brain and spinal cord. While meningitis is more common in younger people, it can affect older adults, especially those with weakened immune systems or chronic health conditions. When it strikes, it progresses rapidly, making immediate action essential. An emergency physician once said, "If an older adult has a fever and can't bend their neck or tolerate light, we drop everything." That's how urgent it is. Neck stiffness in meningitis isn't just discomfort. It's a sign that the brain's protective layers are inflamed. Sensitivity to light, nausea, vomiting, or a feeling of intense pressure in the head are additional red flags. These symptoms suggest your central nervous system is under attack, and delaying treatment can lead to severe complications or death. Jerry, a 75-year-old avid crossword puzzler, experienced this when he woke up with a pounding headache and a fever. By afternoon, his neck was so stiff he couldn't look down, and the kitchen light felt unbearable. His neighbor, a retired nurse, recognized the signs and drove him to the hospital, where doctors diagnosed bacterial meningitis. Thanks to prompt treatment, Jerry survived. "I thought I was just run down," he said. "I had no idea it could be so serious." If you or someone you love has a high fever with neck stiffness, light sensitivity, or confusion, don't wait for an appointment or try to tough it out. Call 911 or go to the emergency room immediately. Early treatment with antibiotics or other interventions can be life-saving. Note the onset of symptoms and any recent illnesses to help doctors act quickly. Final thoughts. Empowering yourself with knowledge. Your body is your greatest ally, constantly sending signals to guide you toward better health. The 7 symptoms we've covered: slurred speech or facial drooping, sudden chest tightness, shortness of breath without exertion, unusual confusion, severe abdominal pain, persistent vomiting or vomiting blood, and high fever with stiff neck are not meant to frighten you, but to empower you. Recognizing these warning signs and acting quickly can mean the difference between a full recovery and a life-changing tragedy. Here's a quick recap of the critical signs and actions. Slurred speech or facial drooping could indicate a stroke. Use the FAST acronym and call 911 immediately. Sudden chest tightness or pain may signal a heart attack. Don't dismiss it as heartburn. Get to the hospital. Shortness of breath without exertion could point to heart or lung issues. Seek emergency care. Unusual confusion or disorientation may indicate a stroke or infection. Don't assume it's just aging. Act fast. Severe abdominal pain could signal a ruptured organ or a blockage. Go to the ER if it's sharp or persistent. Persistent vomiting or vomiting blood may indicate internal bleeding. Call 911 or seek immediate care. High fever with stiff neck and light sensitivity could be meningitis. Get to the hospital without delay. Taking care of your health isn't just about you. It's about the people who love you and want you around for years to come. By listening to your body and acting decisively, you're giving yourself and your loved ones the gift of time, health, and shared moments. Don't brush off unusual symptoms or assume they'll pass. Keep a list of emergency contacts handy, and don't hesitate to call 911 or ask a loved one for help if something feels wrong. We'd love to hear from you. Please leave a comment below with one thing you learned today and how you plan to use this knowledge. Your thoughts inspire us to keep creating content that informs and empowers. If you found this guide valuable, please like, subscribe, and share it with others who might benefit. Thank you for joining us. And here's to staying vigilant and thriving at every stage of life.